February is Heart Month, and a Des Moines mom is on a mission. She's sharing the story of her son's successful heart transplant and the testing that is protecting the rest of her family. WHO 13's Amanda Krenz has the story.
And then it boom.
Tanika Rowland knows what it feels like to get her heart shocked.
I had just come in from Walmart, shut the door, and I was like, man, I'm out of breath. So I was like, let me get ready to sit down. And as I was about to sit down, that's when I got shocked by the door. And then I proceeded to get shocked four more times.
The shocks saved Tanika. They came from a device in her chest, an ICD, implantable cardioverter defibrillator. It monitors her heartbeat. It can also correct her heart's rhythm and even save her life.
So for me, it's for preventative purposes because the gene is known to cause sudden death and or cause heart failure.
Tanika learned she carried that particular gene after her son Khalil experienced heart issues and eventually learned he would need a heart transplant.
And when I got tested in 2017, found out that I also carry this gene. And basically what they're telling us is that every human has this gene. Ours just happens to be spelled differently.
There are a few genes that can be identified which can cause those. And so genetic testing for those can be very important in the family, especially if there's one member who's severely affected.
Medical professionals like Dr. Johnson say genetic testing just keeps getting better. It's as easy as a saliva or blood test, but there are also simple things you can do to look into your own family history.
That is looking at 3 generations of your family, first in first degree, so mother, father, sister, brother, and children, and see if there is a history of a heart attack, history of a stroke, high blood pressure, a sudden cardiac death.
A lot of love in this pillow right here.
Tanika's son Khalil had that successful heart transplant in December of 2022, and he's perfectly healthy today. Because of his journey, Tanika and her extended family are now aware of their own potential health risks.
We've had 11 of my family members have been tested, and 8 of us of the 11 carry the gene.
Tanika says having a certain gene mutation doesn't mean you'll have heart issues, but it makes you aware, and in her case, motivated her to take preventative measures with her ICD. And because she has learned so much about heart health and family history, Tanika is spreading her message to others. She's a public speaker. She's designed a flyer about genetic screening and has shared it with crowds of people. And she's even produced a docuseries called Heart to Heart, featuring her son and 4 other African Americans who suffered through heart-related illnesses. She continues to share the message of heart health and knowing your family history wherever she goes.
Heart disease can happen to anyone, anytime, anywhere. And I hate for people to find out the hard way.
In Des Moines, Amanda Krenz, WHO 13 News.
While checking into your family history doesn't cost anything, the cost of genetic testing does. The price can range from free to hundreds of dollars, though sometimes it is covered by health insurance. The first place to start is with a conversation with your family physician.